Hello everyone, my name is Fatimah Majeed and I am a Culture Competence Coordinator for Arab American Mental Health Association. Today I'll be talking about mental health in diverse communities. Mental health affects many of us, yet many people struggle to get the support they need. To start off, let's define what mental health is and why it matters. What is mental health? Mental health is our emotional, mental, and social well-being. It affects how we think, feel, and act, and it helps shapes how we handle stress, relate to others, and make choices. Just like physical health, mental health requires attention and care to maintain balance. Mental health is just as important as physical health because both affects overall well-being. When mental health is not taken care of, it can impact daily life, making it harder to stay motivated, focused, and physically healthy. Having a good mental health helps people understand and manage their emotions, whether they feel happy, sad, or stressed. It also makes it easier to form and maintain healthy relationships, stay focused in school or work, and deal with everyday challenges with confidence. Even though mental health is very important, many people do not ask for help when they need it. One big reason for this is stigma, which makes people feel embarrassed or afraid to talk about their struggles. So, what is stigma? Stigma is when people have negative or unfair beliefs about mental health. In many communities, mental health struggles are seen as something to be ashamed of, which makes people afraid to talk about their feelings or seek help. Instead of getting support, they may keep their struggles to themselves, which can make their situation even harder. Stigma can have serious impact on mental health. When people feel judged or misunderstood, they might avoid reaching out for help, even when they need it. So how does stigma affect mental health? Stigma affects mental health by preventing people from seeking help, increasing feeling of shame and guilt, lowering self-esteem, causing isolation, and creating barriers to education, work, and housing, all of which worsen their overall well-being. To understand the impact of stigma, let's look at some challenges and stereotypes that exist. Many people avoid talking about mental health because they are afraid of being judged by their family or friends. In some cultures, people believe that problems should be handled alone without outside help. Others think that mental health struggles happen because of lack of faith instead of being real medical conditions that need treatments. Another big challenge is lack of awareness. Many people don't know much about mental health or the types of support available. Some also believe that taking mental health medication is a sign of weakness or that it is unsafe, which stops them from getting the care they need. So why is it important to address mental health? Addressing mental health helps reduce negative views, making it easier for people to seek the right care without fear of judgment. When more people understand mental health, it leads to better well-being and happier, healthier lives, allowing individuals to take control of their mental and emotional health. It also reduces unfair treatments and families can offer more support and a better understanding. And most importantly, when mental health is taken seriously, it encourages more people to seek help early, preventing conditions from getting worse and leading to better long-term outcomes. Let's talk about the barriers to mental health care in the United States. What are the major barriers to mental health care? One of the biggest challenges is that many people don't trust the healthcare system, which makes them less likely to seek help. Another major issue is the lack of health insurance, which makes therapy and treatment too expensive for many individuals. The high cost of treatments makes mental health care unaffordable for many people. Even for those who can afford care, there are not enough mental health providers in some areas, especially in smaller communities. Culture differences also make it difficult for people to get the right care. Some providers may not understand different culture, making it harder for patients to feel comfortable opening up. And then lastly, culture stigma prevents people from seeking help as they fear judgment from the community or family. These challenges make it difficult for many people to seek help, but the biggest obstacle is still the stigma around mental health. Overcoming this stigma is key to making mental health care more accessible and accepted. Let's talk about how we can do that. Breaking the stigma around mental health starts with changing how we talk about it. People need to know that getting help is normal, just like going to a doctor for physical illness. Learning about mental health and understanding common issues can also help break misunderstandings. Encouraging open conversation without judgment allows people to feel safe discussing their struggles. And small actions like showing kindness and support can make a big difference in someone's life. It's also important to challenge false beliefs about mental health and speak positively about it so more people feel comfortable seeking help. Breaking the stigma is an important step, but taking care of mental health doesn't stop there. Along with support from others, self-care plays a big role in maintaining mental well-being. Let's look at simple ways to take care of yourself and help those around you. Simple ways to take care of yourself. Share your thoughts with a friend or family member. Go for a walk, jog, or do some yoga to feel better. Write down your feelings or thoughts. Try drawing, painting, writing, reading, or playing music. Relax your body with slow, deep breathing. Aim for 7 to 8 hours of rest each night. And enjoy nature even if it's just for a few minutes. How to support others. Let them talk without interrupting. Tell them you care and it's okay to feel how they feel. Call or text to see how they're doing. Encourage them to talk to a counselor or psychiatrist if they need help. And if they need time alone, respect that, but let them know you're there when they're ready. Self-care is important, but sometimes it's not enough. In some situations, professional support is needed to manage mental health effectively. Let's look at different options and resources available. Free and helpful resources. Crisis text line, text hello to 741741. 988 Lifeline. It's a national mental health hotline for anyone in crisis. And for more resources, you can visit arabmentalhealth.org/resources. Professional resources. Many mental health clinics offer access to therapists, counselors, and psychiatrists, providing treatment and support for a wide range of mental health needs. Let's go over the key takeaways from this presentation. The key takeaways. Mental health is just as important as physical health. Stigma can prevent people from seeking help, but we can break it by learning, supporting, and encouraging others. Self-care and professional help can make a big difference. It's important to remember that everyone deserves support and understanding. By working together, we can build stronger and healthier communities.